Welcome to Insider Medicine in Depth. I'm Dr. Susan Sharma. For those who have or are at increased risk for cardiovascular disease, living alone has been linked with an increased risk of dying in research published online ahead of print in the Archives of Internal Medicine. Here are some tips to maintain cardiovascular health as you age. Refrain from smoking. Take medications your doctor prescribes, even if you don't feel sick. Stay physically active. For up to 4 years, researchers from Brigham and Women's Hospital and Harvard Medical School in Boston followed nearly 45,000 people who were middle-aged or older and who had or were at increased risk for cardiovascular disease. The investigators looked at the relationship between the participants' living arrangement and their risk of dying after taking into account their age, sex, other health-related risk factors, treatments that they were taking, and socio-demographic factors. Overall, nearly 20% of the participants were living alone. Those who lived alone were slightly more likely to die from cardiovascular disease or from any cause during the follow-up period than those who lived with others. This association was most notable among the younger participants. Among those 45 to 65, living alone was associated with a 24% increased risk of death, while those aged 66 to 80 had an increased risk by 12%. The association between living alone and the risk of dying disappeared for participants over 80. We had a chance to speak with Dr. Deepak Bhatt, corresponding author of this study, who offers some further insight.
We examined several thousand patients with cardiovascular disease or at high risk of cardiovascular disease from around the world and found that living alone was a risk factor for a higher risk of cardiovascular death, that is, dying from cardiac causes, or for that matter, just dying, period. So in addition to other sorts of risk factors that are known and established, things like high blood pressure and diabetes, we found that living alone was an independent risk factor for adverse cardiac outcomes.
Today's research suggests that living alone can worsen your prognosis if you have poor heart health, but these findings need to be confirmed with additional studies. For Insider Medicine in Depth, I'm Dr. Susan Sharma.